Good morning. Welcome to the Pickens County Educational Center in Carrollton. We are in the lab today. So I want to show you about IV fluids and tubing, and then later we will do an IV start and do some IV meds on the mannequin arm. Okay, to get started, I want to show you, this is a bag of half saline. And you'll see that it comes in a cover wrap, and there's a little notch at the top which allows you to open it very easily. So I'm going to take this out. Get that there. And when you are opening up a bag of fluid for your patient, give it just a little squeeze to make sure there's no leaks. Look at it, make sure there's no floaties inside it, and that it looks like the normal color. So those are some things to check about the integrity of the bag. Also, I want to point out, if I can get my videographer to come a little closer, on this bag of fluid, you'll see it has osmolarity 154. As you will note from lecture, IV fluids that are less than 240 are hypotonic, and any IV fluid that is above 340 is hypertonic. Now this is based on the osmolarity of our blood. Our blood is about an average of 290. It's not exactly the same for everybody, but it's around 290. So anything that is from 240 to 340 would be considered isotonic. Okay, now then, we've got that cleared away, and I did note that there is an expiration date on the bag, so always check the expiration date as well. Now then, we're going to spike this bag and prime the tubing. Now, because I'm short, I usually spike holding this in my hand, but some nurses are very good about spiking while it's hanging up there. But let me show you something. I don't think, no, I'm going to pull this off. Okay, I'm going to show you that it does not leak out when your cover is taken off, but you want to make sure that that is kept sterile. Now, I'm going to just show you this primary tubing bag because there is a drop factor on here I want you to see. So if I can get a close-up where you see drops per mil, and this tubing is a 15. Now, I'm not going to use this tubing. I'm going to use one that's already been used before. It's already out of the bag, but I did put a top on it, a sterile top. And it also has a sterile cap at the bottom. The very first thing you do when you take your tubing out of the bag is roll the clamp down. This is called a roller clamp. This part is called a drip chamber. Now I'm going to take this back down. And I'm going to take the top off. And very carefully, I'm going to put it in. And sometimes you have to give it a little twisting motion. It's very important that you keep your fingers on the port here because the spike is very sharp and can easily penetrate this plastic. So if you can put your fingers there, that helps to guide that tip and you won't puncture the bag. And I'll stick this back up here. Okay, now if I had forgotten to put my roller clamp in the down position, this fluid would just be going everywhere and you would have bubbles everywhere. And even when you try to control this, sometimes you will get a bubble, but we're going to work on that. Okay, before I before I prime the tubing, let me point out, this is called a Y-port. And it is a luer lock needleless port. And in a little bit, I'll show you another IV tubing that has a needle port. Okay, let's squeeze the chamber, and you're going to fill it up to about that much. You want to be able to see the drops dripping in the chamber. Okay, now then I'm going to bring this over to the sink. And this particular tubing, oh, here's another port down here. And if you can turn these ports so that they're pointing to the ground, that helps to fill up the little area right here and get the ports primed. Okay, so you almost need 3 hands to do this. But let me get it past this point first. I'm going to slowly open it, and I'm watching. I'm going to watch here. I'm going to watch this fluid come down the tubing. Okay, now then, it's through that port, so I'm going to let go of that one. I'm going to keep this one down toward the floor. And you can see this was a used tubing, and it already had some fluid in it, even though I had hung it out to dry while we've been gone. Okay. So I'm trying to get all these bubbles out, but I'm going to stop it right now. Now sometimes you have to loosen the end of the, take this top off because it will not flow good. Depends on the tubing. Sometimes you can just leave it, it'll be fine. But I can see so many air bubbles. So I'm going to try to, if you'll just kind of put some tension on it and thump it like you're playing a guitar, and then these air bubbles will go up to the top. So you want to hold your tubing up so that those bubbles will rise to the top. Okay. All right. I think I kind of got them all together now. Here we go. Okay, stop it again. Get some more out. It's important to have your IV tubing free of the bubbles. Do not want to get air into our veins, into our system. Is my hand in the way? Okay, alrighty then. We were able to do that, and I don't know if this is the original cap that goes on it or not, but I found something to put on it. Alrighty, so I've got all the bubbles out. Alrighty, now then, let me just hang this tubing right here, and let me just talk to you just a bit about secondary tubing. Now you saw how long this tubing is, and 72 inches is a very standard length. Let's see if this, the length on this one that's in this package is 104 inches. So if it's a long tubing, you know that that's the primary tubing. But let me show you a secondary tubing. Now look how short that is. In fact, let's see if it has a length on this one. It does not say how long it is, but you can see that, oh, there it is, 34 inches. And I'll show you, it comes in a bag like this, or something similar. It's gonna have the drop factor on it, and this one is a 15, and it comes with a hanger. And this is why you'll need the hanger. You will drop the IV primary down if you're going to be having a piggyback. Now this bag does not have any fluid in it, but I just wanted to demonstrate. It's the same thing for spiking and priming the tubing. You'll do exactly the same thing. Turn off, roll down the clamp. You'll take this off, Remember to keep everything sterile. Kind of twist it in. Okay. Then you would bring it over at your sink, do your drip chamber, and let's get my roller clamp here, and do it. Okay, it's completely primed. I'm going to turn it off, and I will hang this up higher. Okay, now then, let's see. I want to use the port that's closest, so that's going to be this one. Okay, so before I connect it, I'll need to take alcohol and clean it. Okay, so you want to scrub it on the top and on the sides there. So give it a 15-second scrub. Okay, so remove your sterile cap. Remember, you go in and turn so it's tightened. Okay, now then you have your piggyback hangs higher. Okay, all right, now then let's move over here. I'm going to show you some other tubing. Now this is tubing, it has a special cassette, and this goes into a pump. If you were priming this, you would, this is a needle port. This is something that you will not see these used in the facility anymore because of the Needle Stick Act. Everything is done with lure locks now, as far as I know. But if you were priming this, let me put this up here so I can hold it. See, tubes is notorious for getting tangled up. Okay, am I untangled yet? It's just so long. So you're priming this. You will have this port facing the floor. And you will be watching this, and when you see the fluid, can you see this round bubble here? When you see fluid coming into that little bubble chamber, you immediately flip this over and then let it continue to prime and get all your bubbles out. And then this will just fit right in here. Of course, you clamp it off and close it down. Okay, so that's how that works. And then this is a very user-friendly pump, and you can put in how many mils per hour. Pump rate is always mils per hour. Okay, the other tubing over here, I want to show you, has what is called a dial-flow on it. If you'll see, it has numbers. So if you can turn it, let's see, it's on the off. See, 50. Maybe the doctor has ordered the fluid to infuse at 90. You'll just turn it, and this is not exact, but it's approximate, but it does a pretty good job. And it's much less inexpensive than having a pump for certain situations. This is common in home care. The tubing that I used to use to do my infusions had a dial-flow on it, but then I realized I could really get cheap tubing if I didn't even have anything and I just count my drops. Okay, which, let me go back to this, and I want to show you how to count drops. Okay, take this down. I'm going to put this over in the sink. Okay, so that it will be there. Okay. I'm going to turn this off. Okay. Okay, let's say that our, because we saw that, and I'm not even sure if this tubing, what drop factor is, because it was not in a package. But let's just say that it's 10. So we have done our formula, and we know that we need to give this at 60 drops a minute. Okay, so we want to turn this on. We want to divide our 60 by 4, which would be 15. And then we want to divide our time, our minutes, into 4, which would be 15 seconds. So I'm going to look at my watch, and I'm going to go ahead and start this dripping, and I'm going to try to get 15 drops per 15 seconds. So I know that's going to be even about 5 drops every 5 seconds. I mean 3 drops every 5 seconds. So let me count this. 1, 2, 3, 4, 5. A little fast here. 15. Okay. Alrighty. That didn't take too long. Sometimes you'll stand here forever trying to get it right. I won't take the time to do a full minute check, but that's what you would want to do for your patient is after you have done it for 15 seconds and it seems to be right, time it for a whole minute to see if you get 60 drops for your minute. Okay, I'm going to go ahead and turn this off. Okay, now then, let me show you. This is called, well, it has several names. I've always called them a buretrol. But I have seen them since then, like in our textbooks, call them burettes, volutrols. But you can put this into your main fluid here, and then you drop out as much as you want. I used a lot of these in the intensive care unit because you want to measure very carefully and not have fluid overload. So you would just only drop what you would need for an hour. So if the doctor wanted 100 mils per hour, you just put your 100 mils, fill it up to 100 mils. And then you would know you would need to go every hour and drop another 100. And it's much more precise to measure small volumes and to make sure that you do not have fluid overload. You'll see these used also in pediatrics. Okay, now then I want to talk to you about the blood. Now put a pair of gloves here. Whenever you handle blood, you need to have gloves on. Of course, you'll see I do not have a real bag of blood. I've actually got a biohazard bag that is folded up to simulate a bag of blood. But you will see on this bag of blood, it's got a lot of information. And you'll need to know the type of blood, the RH factor. See, it says positive, so this is O positive blood. It's got a number here. It's got expiration date. And this is a type of bracelet that would be put on the patient by the blood bank when they did type and cross match. They would be given a number. So this number here would need to match the number that's on your blood. You will learn more about transfusing blood in the lecture. But let me demonstrate how to set up the blood set. Now I have 2 up here. This one, see, do you recognize this? This is the cassette that will go in a pump. You have to make sure that the pump that your hospital has is approved for blood. So if it is, then you can put your blood through the pump. Okay, you will need to have 250 mils of normal saline. Remember a while ago, your blood has a osmolarity of 290, right around 290. And this normal saline, let's see, let me read the osmolarity, 308. So remember, that is, it's not below 240, it's not above 340. So that means it is isotonic. So it's compatible with your blood. It's almost like your blood. Okay. So I will take off these have sterile caps on them. So I will take off the sterile cap and I will insert one of these. You'll see, and hang it up so that you can see this. Okay. So the clamps are all off. So you'd open up the saline, because you're going to use the saline to prime the entire tube. So you'll open this up. Press on this. This is a filter. Your blood products have to be given with tubing that has a filter. I think they want it to be at least a 200 micron filter, but don't quote me on that. And this will go all the way through. Okay, and I went ahead and just cut it off. We're not going to prime the whole tubing because I've already shown you how to do that. Then after you have done your tubing, then you would pull the top off of your blood, and remember you would have gloves on, and you would spike this side. And this doesn't have a hanger, but this would hang up here, and you would use this. Lower that. Oh. Okay. Alrighty. And then this would be hanging here. You would open up this roller clamp so that this blood could prime this tubing. And then this will, as soon as it hits this saline in here, it's going to turn red. And then you can go ahead and, because the tubing is completely primed already with your sodium chloride or your saline, and put this cassette into the pump. Okay, now then, I just want to show you. This is a blood tubing. It's got the little nice paper wraps to keep it organized. Okay. This is tubing that does not go on a pump. So the first thing you do when you take tubing out of a bag is close off all the clamps. So just roll these little rollers down. Okay. Roll it down. Let's see now. Kind of see if that's everything. Oh, no, that one's down. Should be 3. 1, 2, 3. Okay. Has the filter on it. Has the Y connectors here. So one side goes to the saline and prime it completely. Roll the clamp off. Spike the blood and let it prime this side of the tubing. And when it's completely done, you will have to, then you will administer it to the patient, but you're going to have to count your drops. You want to infuse slowly to begin with, and then when it's they're past that 15-minute time frame where they would most likely have a reaction, if they're going to have a reaction, and then you can speed it up a little bit. But usually start at about 20 drops, 20 mils, 20 drops a meal. I think that's what I'm trying to say. Which would, if you were on a pump, it would be about 50 mils per hour. So give it slowly to begin with. All right, now then, I think that is all that I was going to show you. I do not see, here it is. Okay, remember we hung this piggyback. I've got a couple of piggybacks here. Now this is a piggyback, has the medication applied to it. This has a special little adapter thing, so when you get your medication, you can puncture the rubber diaphragm, and then you would have to, there's a thing right here, see the fluid, this is so old it has completely dried up. Then you would break this little part here, and then you would squeeze some fluid into here to dilute this, and you just have to keep shaking and shaking and shaking. You may have to put some more in there, turn it up, squeeze it, and just keep shaking it till it is no lumps or little clumps of medications. You want it to be completely dissolved, and then you can keep squeezing until you get all the medication back into your bag. Okay, and then this is one that I just did here for Simulation Lab, where you just put, you have to maybe make your own little bag, or the pharmacy makes it for you, just depending on your facility where you work. But I just use this right here because this is an example of a medication added label that you would put on your bag. But these are the only two I have, so I don't use them. I just use them for show and tell. Okay, I think I have gone over everything that was up here. So that'll be the end. I'm going to get prepared now to show you how to start an IV, how to give IV meds, and then to take the IV out. So I'll see you in just a little bit.